everyone, this is Dr. Campbell. I want to talk to you a little bit about treatment of anxiety disorders from an integrated Christian cognitive behavioral therapy strategy. And I've been dealing with anxiety disorders for a long time. In fact, it's one of the areas that I specialize in. And you will also have to learn a lot about anxiety disorders because you're going to have a lot of people coming into counseling with anxiety disorders. So it's going to be something you're going to gain some expertise over time. So you need to study and learn and, start to conceptualize anxiety disorders. One way I think about this is that anxiety disorders are triggers from the world which turn on the autonomic nervous system, the autonomic response in the nervous system. In particular, it turns on what's called the sympathetic side of the autonomic nervous system. God wired us this way, and it's important that we are wired that way, that we have a nervous system that responds to stress and responds to events in our life, because it can help us a lot by avoiding things that are going to hurt us. So that's sort of why it was wired there. It has adaptive purposes that God built it in there. But that something that was meant for good, of course, can start to be bad in terms of our lives if it takes over and the autonomic nervous system is working to some extent, overworking, and it's causing us to fear a lot of different things in our world. I talked to you a little bit already about how some of those fears are trained by parents who teach us to fear, and that the world's a scary place. So we do need to go back in the history and look at the origins of the fear and to figure out what happened there. But once again, some people are just very sensitive and they're prone to anxiety. In fact, I think most people with psychological disorders have very sensitive reactive nervous systems. So that's just my little observation on that. But let's talk about the different types of anxiety disorders. They usually can be discriminated by the specificity or of the stimulus that's triggering the anxiety. For example, in a simple phobia, the stimulus that's triggering the anxiety is very specific. It's like my mom's afraid of cats, and so she sees a cat, her nervous system reacts. By the way, her father had taught her that fear, and there was like an old wives' tale that cats could cause certain problems when she was growing up and someone threw a cat on her. Anyway, she learned that fear. And very often fears and anxiety are learned through experience in the environment. And so we need to look at those origins. Excuse me. Then the stimulus that triggers anxiety can be more generalized. For example, in a social phobia where an individual is fine except when they have to speak in front of people, and that triggers anxiety. Then we have what's called generalized anxiety, which is a broad spectrum anxiety, which is where we have any type of stimulus just about triggering anxiety. So it's generalized. And anxiety tends to spread out, can start specific, and then it sort of spreads out and involves other stimuli in it. And generalized anxiety is very tough to treat and very tough for people to get over, and because it's obviously been something that they're responding to in many different aspects of their life. So it's important to look at how specific the stimulus is that's triggering the anxiety. Now, we talked about how the nervous system reacts and how it's, God sort of wired it in there to react, to run, and then think. It's a very primitive response. It's like a knee-jerk, and our anxiety is often like a knee-jerk. It can be adaptive, but it can also be maladaptive. We can start to become afraid of far too many things in our world, especially if we're being taught that and we're very sensitive people. So I want you to know also that anxiety disorder, symptoms of anxiety, can be caused by medical conditions. For example, hyperthyroidism or certain heart disorders, etc. can have side effects. Certain medications can have side effects of anxiety. So it's important to, if you have a client coming in with anxiety, you might the first session sort of do an analysis of what's going on, but you might also refer that client for a complete physical so that we can figure out whether any of the conditions that they're experiencing were from physical problems. Now, in disorders such as panic disorder, by the time the person gets to me, they've usually gone through a lot of doctors and they've gone through a lot of tests because they think they're dying or going crazy. Now, panic disorders are one of the exceptions to the stimuli being out there that's triggering the reaction. The stimuli in anxiety disorders seem to be internal or proprioceptive. By definition, you can't really tell what is causing you the anxiety disorder. It's hard to put and the panic attack, it's hard to put your finger on it. But what a panic attack is, it's described as a false alarm in your brain. Basically, your brain goes, ooga, we're dying, unbelievably bad feeling. You feel like you're going crazy, losing your mind, going to die, depersonalization, derealization. It's really unpleasant. It's sort of, my analogy there is it's like walking down a hallway and then getting into a seat and being electrocuted, but not dying. It's that traumatic. So you might imagine that when people have these, they have what happens is they get secondary conditioning of lots of that response. For example, if they start to think about walking down the hallway, they'd start to experience anxiety. If they start thinking about going in the building, they start to experience anxiety because it's so much associated, and they'll try to avoid those situations. So you can get panic attacks with agoraphobia, for example, where an individual has thought through this so much that they're afraid to go out at all because they might have a panic attack, and if they have a panic attack, then who will help them? And so they tend to stay inside. So that's an extreme example of that, of the consequences of the panic attack and the secondary conditioning. Now, of course, as Christians, God doesn't want us to be anxious. It says, do not be anxious about anything, but in everything with prayer and thanksgiving, present your requests to God, and the peace that transcends all understanding will guard your hearts and minds in Christ Jesus. There are a lot of scriptures that are sort of anti-anxiety scriptures. And sometimes with the Christians, I'll hand them the Bible and I'll say, here, show me in here where it says to be anxious. And of course, there isn't anywhere where it tells you to be anxious. In fact, there's a lot of scriptures, cast all your anxiety on Him because He cares for you, etc. And I memorized a lot of those because I tend towards anxiety. So the scriptures do help you, and they are powerful, but it's not the only thing. My emphasis with anxiety disorders is often the flesh part and the truths of the flesh, and I try to help people reduce their overall level of anxiety. And I use a device called a motivator, and the technique is called cue controlled relaxation. And basically, every 7 minutes, this motivator I use and I wear goes off and it buzzes, and then when it buzzes, I'll take a slow deep breath in through the nose, out through the mouth, and as I'm doing that, I'll say something such as, let go and let God. There I'm using the flesh part. The cognitive part is the thinking part, and the flesh part is the slow deep breathing. And slow deep breathing is totally incompatible with anxiety. So I use that to try to turn off the nervous system and to desensitize people to the world out there so that their threshold, it takes more of a stimulus to trigger an anxiety response. Because usually people are very sensitive, and it doesn't take much to trigger the anxiety response. So that's my main tool that I use in terms of dealing with the flesh, and I use scriptures in combination with that, and I use prayer, etc., even meditation. I'll teach people to meditate. But the slow deep breathing is very powerful, and it's one of the basic tools I use to reduce anxiety. Now, there are other things that I help people do. I get them plugged into exercise usually. That's very important to reduce anxiety. Drinking liquids is important. There's a lot of water. That's good to do for anxiety. So there are other flesh things that are important, as well as tying people into something bigger than themselves, getting them back to church, getting them looking at things in a different way, helping them change their perspective. Now, the actual additional treatments to bring about a relaxation response from a psychology point of view can include, for example, progressive muscle relaxation, which is a technique where you tense and then relax. So you tense your muscles and then relax. There's mental imagery where you think of pleasant things and pleasant situations, and your anxiety can go down. There's biofeedback, which is wiring yourself up, and then as you relax, say a sound will go lower or higher based on whether you relax, and that's the feedback you get. So you learn to relax through that technique and meditation. So there are lots of different tools that you can use. I tend to use that cue-controlled relaxation to bring about that response, and I'm very successful with that. At the same time, I'm teaching the scriptures and I'm teaching truths about the world, that it's not really a scary place when you have God and you have the big picture there. So I try to bring people back to a knowledge of the truth, and the truth will also help set them free as I work on their flesh to also learn how to relax. I have an interesting video that I made on my daughter who learned in the womb and learned the word relaxation in the womb, actually the Word, and I'll give you a link to look at that so that you can have a look at the power of relaxation and slow deep breathing, basically. So that's a way that I integrate and look and treat anxiety disorders from a flesh sort of perspective, using cognitive behavioral therapy, changing thinking, changing behavior, and using behavior modification techniques. And by the way, you should learn a lot about behavior modification, reward and punishment, because I conceptualize anxiety disorders, especially in terms of negative reinforcement. And I've already given you a handout on that, on negative reinforcement, so I suggest you go back and look at that, because it's really an important way to understand, for example, obsessive compulsive disorders, etc. So I can conceptualize those using a combination of my behavioral treatments and understanding of behavior modification, and my understanding of the flesh, understanding of relaxation concepts, and then also the spiritual realm, where we help people to look at things deeper and bigger and from the perspective, from God's perspective, and that we're all going to be going home, and this world is troubled, and we must keep looking up and keep looking to God for our strength, and nestling under His wings for our peace and our relaxation from there, and it comes from Him. So all these things can be combined in the treatment of anxiety disorders, and I hope you're going to be very successful in that. God bless.